Hi everyone, this is Dr. Stefan. In this video I have a question that, let me see how I answer this one. Should I be afraid of inhalers? Will they kill us before our time? Oh my god, this is very dramatic, okay? So I have to say that. So guys, please, inhalers are some of the safest medications you can take. Now imagine if you're taking a tablet and you are swallowing a tablet, it needs to dissolve throughout your body, eventually get to the organ that it needs to target. With an inhaler, you're inhaling the medication directly in the airways where it's treating an airways disease. So if you're suffering with asthma, you're taking, for example, maybe inhaled corticosteroids in a very low dose. You inhale it in the airways where it's needed. You don't need a lot of medication to do that because it will affect the airways locally. So it's as if you're putting cream on a wound. If you're using ointment for something, it's the same sort of principle. You're trying to get the medication where it's needed. So in that sense, it's really hard for an inhaler to cause a lot of problems. Of course, there can be side effects. No medication exists in this world without side effects. There are no such medications. We haven't got them. If someone tells you that there is a treatment, even if it's from nature or plants or whatever, and it has no side effects, that's not true. Now, you need to have common sense about this. This is my perspective. You cannot believe everything that you hear about only benefits. And you can Google this for yourself. If you just think about turmeric or think about any, I don't know, just put whatever you want, fennel. And if you put that word and benefits and you Google that, you'll probably find a web page that will confirm that there are only benefits for using that specific things. Benefits of bread, benefits of rice, benefits of aspirin, you will find something that confirms. That's confirmation bias. There are no treatments in medicine, no matter what it is, that have no side effects. I don't believe that. I don't believe that. Every person is so different. Everyone can have reactions to things. But when it comes to inhalers, the benefit risk is very, very positive. So it means that the benefits of using inhalers for conditions such as asthma, which can be life-threatening, for COPD, where the symptoms can be debilitating and you can't work. If you're using these inhalers with minimal side effects, maybe you get a bit of voice hoarseness. Maybe sometimes they give you a little bit of a shake. But if you're controlling a condition that can be potentially fatal, or it can lead to an asthma attack that gets you into hospital and makes you really, really unwell. If you're using a medication that only has minimal side effects, but you're controlling something potentially much, much more difficult to handle, I think that's a good trade-off. And will that kill you before your time, like the comment says? I don't know. Probably not. It's probably the condition that's not treated that will make you worse to the point where you're developing other complications, you're developing a flare-up, where you end up in hospital, you need to be on intravenous drugs, medications, nebulizers, intensive care, etc. So you could avoid all that by treating conditions well, especially asthma. Managing asthma well is really, really important. So that's why when I get these questions, should I be afraid of X treatment because it may kill us, it may give us side effects? Yes, all treatments will give us side effects. But not everyone gets all the side effects that are written in the leaflet that gets included in the medication box. No one gets all the side effects. The side effects may be more severe or minor. It depends from person to person. And if the condition that you're having is severe, is serious, needs treatment, do you think that by not treating it to avoid side effects, you're doing yourself a service? This is my question. Now, this video may seem a little bit strange, but I'm just trying to advocate common sense in medicine. Try to discuss with your doctor. Put things in balance. What is the most beneficial strategy for you? To be on a treatment or to not be on a treatment for your condition? How serious is your condition? And not all doctors will give you medication. Now, I'm personally one of these doctors who, if I don't need to prescribe anything to you, I'll probably won't. And many patients actually have the opposite view, that I should prescribe something because they've come to see me. And sometimes I feel like they don't need a treatment. For example, people who have had a cold and they're still coughing 1 week after the cold, but it's getting better. Most people in these situations do not need any treatment. They just need to keep hydrated, return to their daily activities, and the cough will go away. So these are situations where people sometimes ask for medication, which is not really required. But then there are situations when people may suffer with asthma, with severe airways disease, and they don't want to go on inhalers because they're afraid of side effects. And I think that's not a good idea. So always the balance, benefits versus risks. This is all I can tell you. Hopefully this was a good message. If you have further comments, questions, leave them in the comment section below. I'll see you in future videos. All the best.